Hello, this is ECruz, and I am presenting my Proactive Health Communication Plan for DNPU Course 705. I chose the Crow Creek Sioux as the target of my health communication plan. I went on the internet and looked up the poorest counties in the United States, and one of them happened to be Buffalo County, South Dakota. And 79.6% of this community is Native American, and I did some research and did find out that the Crow Creek Sioux live here. There are dozens of different types of Sioux tribes. They actually live mostly in the northern parts of the United States, such as North Dakota, South Dakota, Minnesota, Montana, and the southern parts of Canada like Saskatchewan and Manitoba. But the predominantly poor ones live in Buffalo County here. So a little bit about them. Like I said before, Native American population in South Dakota, Buffalo County, and it's in this kind of like in the central eastern part of South Dakota, as you can see on that map there. Their per capita income in 2011 is 11,162, and 40.8% of the people in this town or in this county live below the poverty level. Okay, in terms of the specific health risks, I went on the website for the community health status indicators, and there's actually a multitude of different things that they suffer from. There's, premature birth weight, or premature birth, low birth weight, coronary artery disease, cancer, things like that. But the part that stood out to me the most was the suicide rate. It's very high for this county. County rate, as you can see, is 121.5 per 100,000 people, and the US rate is only 10.9. So that is staggeringly high for such a small community. It turns out that during the last 30 years, the Crow Creek has experienced a very high suicide rate that has had a devastating and demoralizing impact on this community. It's probably as a result of depression and violence and physical and sexual abuse that plague this tribe, and their extreme poverty level limit its ability to properly address the situation. Now, part of this might be attributed to historical trauma. For those of you who are not familiar with historical trauma, it's this psychological phenomenon that occurs as a result of being brutalized and mistreated throughout American history. And we all know that Native Americans are definitely the victims of this treatment. This historical trauma can lead to depression, self-destructive behavior, anxiety, low self-esteem, and substance abuse. So you can definitely see how suicide can be a consequence of this. The ages afflicted are adolescents and young adults, ages 13 to 21. Okay, the communication theory that I think could be used to help explain this phenomenon is or to help, aid in this, treating this, is the health belief model, or HBM. Now, there are a couple of major assumptions. Well, first of all, before I explain that, a little history behind the theory. It was first developed in the 1960s by Rosenstock, and it was initially developed to study the promotion and uptake of health services. And since then, it's been developed by different researchers, such as Becker, Hefner, Maiman, Jans, and Strecker. This health belief model is predicated on a couple of major assumptions. The first one is that in order to engage in healthy behaviors, the patient needs to be aware of their risk for severe or life-threatening disease. And second of all, they have to perceive that the benefit of the behavior change outweighs potential barriers and other negative aspects of recommended actions. Health belief model was actually one of the first to describe the process of change in relation to health behavior. And importantly, it inspired the development of health education. Now that's extremely important because as nurse practitioners, health education is the foundation of our profession. We exist to educate communities and patients on healthy behaviors and how to perpetuate those healthy behaviors in order to maintain a healthy and fruitful lifestyle. There is actually a program already in place that I was pleased to see actually models a lot of different assumptions from the health belief model. This was developed by the Suicide Foundation, the Suicide Prevention Foundation. It's called the Crow Creek Tribal Youth Suicide Prevention Program. And here are some of the goals and objectives. The first one is to promote suicide awareness through a public information campaign to increase public knowledge and expanded suicide awareness in the school system. Second one is to develop effective prevention and intervention services through community-based suicide prevention and by improving services to people who have been affected by suicide. And thirdly, it exists to enhance service provider capabilities by increasing collaboration among local partners, improving local data and management techniques, and increasing capabilities of local partners involved in suicide. Here are a few more program details I think it's important to mention here. During the summer months of June through August, this program offers Peers Helping Peers, and it targets youth ages 12 to 21. They choose 200 of them, and they're given education and skills training in various areas of risk behavior, and those 200 youth are then required to reach out to 10 of their friends and peers. And the people who are involved in this youth survey, they're given questionnaires and other required forms, and these helping peers are then given a $200 incentive for their participation. And all of the money is provided by grants, by the way. Number 2, during the school year, there was a weekly after-school program called Natural Helpers, where 100 of the youth are challenged to address the programs. Challenged to address problems of youth in school, homes, and in the community, and each participant receives $20 for their participation. During the holiday season, the grant runs a program called Safe House, and in this program, 8 people are hired and trained, and they provide a safe environment over the holiday season for youth to come to. So this is like a safe haven away from their homes, which might be engaging in high-risk behavior such as drinking or substance abuse or physical abuse. It just gives them a safe place to go to so that they know people care about them. Okay, so a lot of those previous program details, they actually focus a lot on some components of the health belief model, such as perceived susceptibility, severity, benefits, barriers, cues to action, and self-efficacy. So I was pleased to see that someone had already taken initiative to create a program that centers on this model that can help and be effective in this community. But let's add something else to that. In this course, we've been learning about new media and how to reach out through social media and use it to our advantage. In the book, in our textbook, we learned about cultivation theory of mass media. And in this theory, basically, it's using media to portray behavior and make it socially acceptable by shaping public perceptions and feelings towards that behavior. They're using mass media to produce long-term effects on target audiences by nurturing feelings through continuous message exposure. One of the greatest ways to do this is through social media, powerful social media such as Twitter and Facebook. For Twitter, I did a little bit of research and I found out that the Crow Creek tribe, they don't have any kind of Twitter account. I think that city officials should take initiative and create a Twitter account. And this needs to be promoted in wealthier South Dakota counties. Buffalo County is very poor, and realistically, it's going to be challenging because you can't really reach out to people in the community. They're the ones who need help. They don't have electricity. They don't have computers and access to smartphone devices and iPads and things like that. So we have to go outside the community and focus on people who are wealthier, have more resources and more means. We need to get their attention and draw it back into the community. So city officials should create some sort of Twitter account and promote it in other communities. I did a little bit of research and found out there's the 4 wealthiest communities in South Dakota. Lincoln County and Union County, they're the 2 wealthiest, and they're actually located very far away from Buffalo. And then there's Hughes and Stanley County. They're the third and fourth wealthiest counties in South Dakota. They're actually located more centrally. Um, City officials need to make an effort and make some phone calls, email, do something to those communities. They need to post flyers or notices in community colleges, cafeterias, libraries, and city halls of those areas, to promote their Twitter account. Okay, promoting the Twitter account on other communities' web pages will, help spread the word faster. And here's a sample tweet that I made up that could really catch someone's attention in the nearby community. Can you imagine a place where too many kids are committing suicide? Imagine no more. It is right here in your state. And we can utilize hashtags. For example, I made one up called Hope for Crow Creek. This can point subscribers towards resources such as food drives and fundraisers for this county because they're very poor. And when they're at a disadvantage of not having any money or any financial resource to help them out of this situation, they become even more hopeless. So we really need to get outside aid and their attention to help raise money for their community so they have more funds towards spending on different resources to help prevent suicide. Okay, and furthermore, there's more promotion that you can do through Facebook. We could use the same kind of promotion or media promotion that we use with Twitter. Have the city officials go to wealthier counties and promote a Crow Creek Health Facebook page. Crow Creek doesn't have their own Facebook page. Technically, they do have one that's for information on their county, but they need to develop one that is focused on health promotion. One specifically for health promotion. Now this account they can post they can post in different libraries, city halls, things like that in wealthier communities to get more attention. This way they can encourage development of after school programs, ROP, career exploration, because now that for Twitter we can get Twitter was for raising money and raising awareness. Now the Facebook account could be to help point towards different resources and hope for these kids so that they know that there's something else out there, that there's potential for greater opportunities such as careers and different activities. They don't have to just stay home and feel like they're a victim or a prisoner of this hopeless situation, that there is a world out there that wants them and appreciates them. So by using these career exploration and support groups through the Facebook account, they can the community can come back to them and raise money and be able to promote awareness for their cause. Okay, above all, we wanted to bestow hope and healing for this county. Mental health is a really challenging thing to treat, and it needs the help of surrounding counties and communities and friendships in order to heal. So by reaching out with social media and combining it with the pre-existing programs that utilize the more traditional health belief models and things like that, perhaps this community will begin to instill hope and make youth realize that there is so much more to live for and that suicide is not an option. That's the end of my presentation. Thank you so much for listening.